Hi, this is Brian Kim. I'm going to share with you case number 71 in the best way to do cataract surgery series. This is a hypermature cataract. It's really actually quite dense. And so you're going to see systematic lens disassembly using double chop, cross chop, and mechanical fracturing. And you'll see there are very stubborn, leathery posterior adhesions and how I use a scissoring technique, amputating those posterior adhesions between the chopper and the phaco tip. I'm going to very carefully and patiently break this lens down, and you'll just see that, it's not that easy to break down a big lens like this. And so I'm using a corneal marker to help me center and size my rexus using the cotton tip. And then I'm making my paracentesis incisions first on the right side and then the left side. Make sure the incision is flat to the iris plane so I achieve a self-sealing corneal incision through the nice corneal shelf that I have. I'm injecting some intracameral lidocaine, and then I'm injecting intracameral air. And then I'm going to inject some trypan blue. I like to just paint the surface. Just be very ginger as I paint, and I'm using the cannula as a paint roller, just kind of going around, putting a dollop of trypan on the surface of the anterior capsule. And this is the dispersive viscoelastic. I'm starting from the other side and pushing out the bubble and the trypan blue. And this is a triplanar corneal incision using the cannula to hold the eye. I make a vertical groove, place the blade into the deep part of the groove, tunnel through the cornea, controlling the eye with the cannula, turning the eye towards me, and then entering. Pushing some more viscoelastic after that to inflate the anterior chamber. Going in sideways with my forceps. I'll puncture the center with the forceps. Grabbing the right side of the tear and then going around circumferentially. Grabbing and re-grabbing and trying to get a well-centered incised rexus. This is a capsular fornix hydrodissection technique. I place the cannula out to the contralateral equator under the rexus edge, get a nice wave, decompress on the left side, turn the cannula tip down on the right side, and the lens spins nicely. This lens is unlikely to have much epinucleus or cortex. I think it's just going to be a big, dense lens with very little posterior capsule protection. I irrigate the surface of the eye. Lift the incision with a chopper, go in with irrigation off to minimize Descemet's trauma. Place the chopper underneath the rexus edge out to the equator contra-incisionally. Turn the phaco tip vertically sub-incisionally. Bring both instruments together, and I'm able to divide the lens. You can see there's still some posterior adhesion. I place the chopper around the right heminucleus, pulling it centrally towards the phaco tip, and then crushing and dividing the right heminucleus. You can see because the lens is so big, there are still some posterior adhesions. And so as I go, I'm going to have to break these adhesions separately. I place the chopper around the first quadrant, pulling it centrally towards the phaco tip, and then trying to separate the lens pieces by cracking them, going back and trying to perform successive chop maneuvers here. Lifting that one fragment up with some vacuum and then chopping it again between the chopper and the phaco tip. Again, there are some posterior adhesions. Once the fragment is somewhat free there, you see I use some vacuum to lift it up. And then I'm doing this scissoring maneuver where I place the chopper and the phaco tip around the lens piece and kind of amputating the posterior adhesion. You can see again, I'm using some vacuum to lift the piece up and then using that scissoring maneuver to amputate the posterior adhesion. Again, grabbing it, lifting it up, and then chopping and amputating the posterior adhesion again. And so that's kind of the technique with this very, very dense lens, is go ahead and chop it, but then if there's any posterior adhesions, going after it separately with a little bit of vacuum, lifting the fragment up, and then going underneath the fragment and chopping the posterior adhesion. So that first quadrant is out. I'm turning the lens very carefully, going after that second heminucleus, placing the chopper around the lens piece, placing the phaco tip deep, crushing it and dividing that lens, and then just cracking and cracking. There are some, again, posterior adhesions here as well. Taking my time and cracking it and cracking it. Almost. There it goes. So finally separated the posterior adhesions, using some vacuum to lift that piece up, getting around it with the chopper, making sure I don't snag the anterior capsule, and then crushing the lens. Again, the lens is so big and it's just requiring a lot of patience and time to get around the lens piece and very carefully chopping the lens up into smaller pieces. So the lens piece kind of turned, and so that's why I'm actually removing first the outer segments of that fragment, because the outer segments kind of presented itself first as the lens piece tumbled. So I'm just trying to chop it little by little by little, and as I do this, I'm able to get around the girth of the lens piece and then chopping it again as I go here. Again, by doing it this way, I'm really using a lot less ultrasonic energy, and I do feel like this is really safer as far as protecting myself from the posterior capsule as well as protecting the cornea. So I'm getting around those two remaining quadrants in that crevice, and then I was able to separate the two pieces, getting around that third quadrant with the chopper, and then dividing the lens piece between the chopper and the phaco tip, and then cracking the pieces here. So now it's separated. Going after that very large fragment here, getting around it between the chopper and the phaco tip, crushing it and dividing it, and then kind of mashing with the chopper and the phaco tip those leathery adhesions. Using a little bit of vacuum to position the lens piece, and then sandwiching the lens between the chopper and the phaco tip. What you're seeing there is I'm just trying to position the lens piece right so that it will bisect the lens piece. Because if it's not quite in the right position, as you try to chop it, it'll just kind of move to the side or tiddlywink off. You can see some of that softer material was getting in the way, so I had to remove that softer, more peripheral lens material first. And now I'm able to hook that denser endonucleus with the chopper, sandwiching it between the chopper and the phaco tip, and then emulsifying it. Using a little vacuum to grab that other piece, it's a much bigger piece, and then sandwiching it between the chopper and the phaco tip, and just doing successive mechanical fracturing forces, again, crushing the lens piece between the chopper and the phaco tip over and over and over again until it's smaller, and then emulsifying the lens piece. Using some vacuum to grab that other endonuclear piece, crushing it between the chopper and the phaco tip, matching it, and then emulsifying the lens piece. At this point, I decided to add a little bit more viscoat to coat the corneal endothelium. With these really dense lenses, it really is important to protect the corneal endothelium. No matter how good your technique, when you have to use all that ultrasonic energy, you're bound to have some potential corneal trauma. So I position that piece between the chopper and the phaco tip, and I start to crush the lens piece. What's interesting is there are some kind of laminations or layers and layers, almost like peeling off an onion with these super dense lenses. So even though the entire lens is dense, the more peripheral lens material is a little bit softer, and that real central core is really the hardest part. But you can see as I'm trying to eat the pieces, they start to kind of separate within their lamellar shells. So yeah, that's a pretty thick kind of mid-peripheral or paracentral lens material away from that central nugget. But it's really, really dense still. I'm having to use mechanical fracturing forces to really crush and sandwich those lens pieces into smaller pieces. And then, of course, once the pieces are smaller, I emulsify the lens pieces. I always try to protect the bag with those maneuvers. If the posterior capsule is exposed, I use a chopper to protect the bag. But if the posterior capsule is not exposed, I like to phaco the lens pieces with a piece of lens material that's buffering between the posterior capsule. So that's what I like to do. If I'm eating pieces, I like to make sure there's a lens piece that's still within the bag to protect the posterior capsule as I eat pieces. So you saw I was able to divide that last quadrant. And so I'm trying to just position the lens piece between the chopper and the phaco tip and just sandwiching the pieces. Again, I'm doing this under irrigation only. It does create a lot of fragments that seem to be floating around, and it does look a little bit chaotic, but I can assure you this is the best way, in my opinion, to break down these lenses. And again, I'm not using any ultrasonic energy during those maneuvers. I won't ever have to worry about the posterior capsule flying up at me as I'm disassembling the lens, because it's only under irrigation as I do this. And once the pieces are small enough, again, I make sure the chopper is deep and I start to emulsify the lens pieces. And I really use a lot of foot pedal modulation when I'm phacoing these pieces. So I'm positioning that last fragment between the chopper and the phaco tip. Again, this is under irrigation only, breaking it up into smaller and smaller pieces, and then grabbing it with a little vacuum, sandwiching it between the chopper and the phaco tip, and then emulsifying the lens piece. So again, it's a little bit more of a challenge because I'm relying on the irrigation and just using my chopper and phaco tip to position the lens piece between the two instruments. Using a little bit of vacuum does help to position the lens piece on the tip, and then I can crush it. So now really these are just the final fragments. I really want to protect the posterior capsule at all costs. I'm keeping that chopper deep in the bag. There's that one final piece that's in the bag, and you can see I'm just using the chopper to hook the lens piece up out of the bag. Again, this is under irrigation only. I'm using the chopper almost like a rake to gently pull the piece up towards the phaco tip and then emulsify the lens piece. So I take the chopper out, push BSS in, take the phaco tip out, and then go in with the INA handpiece. I'm removing some of that lens material from under the rexus edge, but I quickly switched to polish mode because one, I know that there's very little cortex in this very dense lens. And whenever you have dense lenses, I do worry about the zonules. And so you'll see here that the posterior capsule kind of bows upward anteriorly. I'm very careful with my pulsing of the subincisional space with the BSS because the posterior capsule is kind of more in a convex position. So go ahead and push the cohesive viscoelastic. And then I'm using the sweep, and you can see there is a little bit of lens material there, but it's soft lens material. This is the other way. If you're having that convex appearance of the posterior capsule, going in with the cohesive viscoelastic and doing the sweeping position does allow you a very, very controlled way to polish underneath the rexus edge. Again, with these very dense lenses, I do worry about zonulopathy, so I tend to go with a 3-piece lens. So I'm extending the wound with my diamond blade, and then I'm going in with the 3-piece lens, have the bevel pointed towards the left. As I deliver the leading haptic, it comes out planar. Again, the posterior capsule is tending to come up, and so I had to inject some more viscoelastic. As I do this, the bag is deeper now. But I had to go in again because I feel like the viscoelastic is coming out and the posterior capsule is coming upward. I quickly deliver the leading haptic within the bag. Once the leading haptic is in and the optic is delivered, I go ahead and deliver the trailing haptic. I go in with the INA with irrigation off, activate irrigation, go under the optic, remove the viscoelastic from within the bag. Remove all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So you can see this is a very dense lens, a hypermature lens. My CDE was 6.53, fairly little use of the ultrasonic energy in this hypermature lens. You saw that there were very dense leathery posterior adhesions throughout the case. I had to perform multiple mechanical fracturing maneuvers. Even though double chop and cross chop was able to chop the majority of the lens, there was some posterior adhesions there that I had to very carefully lift up the pieces with some vacuum, and then using that scissoring maneuver, chopping and amputating the posterior adhesions with the chopper and the phaco tip. This was, again, a very systematic, very controlled way of disassembling the lens. Again, I use only irrigation when I do those maneuvers. I use sparing amounts of ultrasonic energy, and as well as sparing amounts of vacuum, which, again, with this type of dense lens, the posterior capsule wants to come up. There tends to be more zonulopathy. And because of those factors, I feel like this is really a very safe way to disassemble hypermature lens, again, exposed posterior capsule, as well as potential zonulopathy. So I hope this was helpful to you, and I thank you for your attention.